Hello, welcome back to my channel. I'm going to jump straight into the video. As you can tell by the title, I'm talking about being a new grad in a trauma center or working in the ER that has a trauma center attached to it, whether it be level 1, level 2, whatever your facility has. My experience as a new grad ER nurse at a level 1 trauma center was quite the experience. I can say that it is exciting. You never know what you're going to get, but I will tell you that most hospitals, in my research and from my experience, they don't allow new grads to jump straight into trauma, which makes sense. Like, you have to at least know how to take care of a patient coming through the ER, the ED, or emergency room, or whatever your facility calls itself. You at least have to be well versed and have some experience taking care of patients coming through the ER. So as a new grad, my experience to you would be to jump in on as many codes as you can, helping out with as many stroke alerts that come through the door, anything across the lifespan, whether it be geriatrics, pediatrics, just try to get your hands in on a lot of those things. For me, I believe that the procedural part is very important. So, like, knowing what to do, physically what to do. The mental aspect comes with that, but if you can touch certain types of equipment or certain machines, participate in certain procedures and know what to grab, know what the lingo is in the room, that is a huge point to grasp, especially if your goal is to be a trauma nurse. So being able to tackle the little things before you can jump into that trauma room. My advice to you is never stop learning. Never think that you have learned all that there's to learn in the ED or the trauma department. And I keep on separating the two because the two require different skill sets and different levels of critical thinking, as well as when you get to the trauma side of things, and I'm talking about a trauma center, not an ED that has 2 trauma rooms or an ED that has 1 trauma room. I'm talking about an ED that has a trauma center, relative to most level 1 traumas. Know your stuff, know what you're doing, because the docs are going to expect you to know what you're doing and going to expect you to keep up, and there's nothing like someone expecting you to know something or to do something or to grab something and you just don't know, because time is of the essence in a trauma room, especially when the patient is critical. So that is my advice to new grads. When you're coming into the ED, don't focus so much on the trauma. Focus on being a good ED nurse. Focus on learning how to run a stroke alert correctly and timely. Focus on learning how to run a code. Focus on all of that stuff because that stuff is really important. Also, like if your hospital has a rapid infuser, know how to use it. If there's a bear hugger, know how to use it, know how to troubleshoot it, and know what type of patients need it. So that's just very important. Just all of those little things like that. Learning the patho behind certain disease processes and how and why does it happen and why does it happen to this patient and what does it look like. That is very, very important. And another aspect that I think gets kind of overlooked when we talk about ER trauma type nursing is documentation. I know that as an ER nurse, we are not the best at documenting, but in a case of a trauma or a serious case that is coming through, not to downplay a case that's not as serious, maybe like a ESI 5 or 4, not to downplay them, but just to be completely honest, like, documentation is huge, and you have to be quick on your feet, and you have to learn your EMR. Like, that is very important, because if a patient comes in to you and that patient is immediately transported up to ICU or interventional radiology or something like that, and you aren't quick with the documentation, I mean, there's possibly a delay of care, because you still have to go back and document what you did and what you had to do, and like, the next person don't have time for you to lollygag or fumble or anything like that. So I'm not to say that documentation is number one. No, stabilizing the patient is number one. But I can say that that is huge. So just to recap, like I said, I didn't come here to stay long. I wanted to make a quick video because I have experience working in a level 1 trauma center as a new grad nurse. And to all my new grad nurses who want to work in the ED and want to work in trauma and all of that juicy good stuff, like, I love you guys, and I definitely wish you the best, because it is a journey. It is tough. It's a whole world after nursing school, but you can do it. Anyone can do it if they put their mind to it, and you know, they decided it's something that they really want to do, they're passionate about. So go for it. But I can tell you advice, especially being that I was a new grad, and I was a new grad. My first nursing job is at a level 1 trauma center, a huge level 1 trauma center. I can say that trauma and ED is separate. And it is best that you not so much focus on your goals to get the trauma. You focus on learning how to be a really good ED nurse. Another thing that I want to add before I go is to find out the requirements to be a trauma nurse, because just because you're an ED nurse doesn't mean you just automatically a trauma nurse. There are certifications that organizations require you to get, such as TNCC. You can look it up. It's the trauma certification for registered nurses. Also other requirements, like some of them require you to be an ED nurse for at least 2 years, or at least a year and a half, or 18 months. So find out what those parameters are. I'm sorry. Also, some of them require you to be a BSN nurse versus an ASN nurse. So I know a nurse is a nurse, but some of them have their requirements, and it's best that you find that out before you invest into an organization or a facility, and lo and behold, you don't meet the requirements. One of the requirements that I found was like it was important, but I was like, really? Your scans, like the percentage of scans that when you scan a medication, like the percentage that you actually scan instead of overriding or whatever like that. I mean, we've all been guilty of overriding, right? If you say no, then you're probably lying. But you had to have like a certain percent of scanning medication, and I'm so thankful for that process, because I mean, like, it literally saves lives, because we're human and we make mistakes. Nobody's perfect, so it definitely takes away a higher percentage of that human error. But like I said, good luck, and I will make more videos about my experiences working in the level 1 trauma center and an ED. And like I said, this was my first nursing job straight out of nursing school, and there's a lot to learn. Like, you think you know so much, and I was an ER tech and all the other stuff that came with it. I had a job, a career in healthcare before becoming a registered nurse, and I can say that, like, truly nothing prepared me for working in a trauma center. Like, I mean, I made really good grades in nursing school, did good in clinical, and I thought, like, you know, well, I know this, I know that, but, like, you know, it did help a little. But when you really jump in and you really hit the ground running, it's a huge learning curve. So just prepare yourself. But you can do it. Anyone can do it. Like, anyone can do this if they put their mind to it. So I definitely wish you the best. And once again, thank you for watching my videos. And I will make some more, like I said, about my experience, because I started my career, my nursing career, as a new grad working in the ED, which was at a level 1 trauma center, like the biggest level 1 trauma center in my region, pretty much. So yeah, stay tuned, look for more videos, and I'm out. Thank you. Goodbye.